Thank you so much, Lexi. Glad to be here. I am in Connecticut, but today I'm actually in Nashville, Tennessee. So I had to find a little booth to hide at a conference. So excited for you guys to be here. Good morning, good afternoon, depending on where you are. Today is part 2. So it's a 3-part series. So last week I talked about Lyme disease. Today, I'm going to be focusing on Bartonella, and then next week, it'll be Babesia. I know some people have asked if you make sure to sign up so you can get all the recordings. And I know that Lexi is also going to drop the link in because I know that that's been a question that has come up to me personally. So I'm going to make sure this time it was a really active and engaged group the last time, which was awesome with the questions. So I'm going to be really good about making this 30 minutes. So we have plenty of time to Q&A. If we have more time, I might go back in through content. So it'll really depend on how Q&A goes with the content. So let's go into the presentation. Okay. So as I said, last week we focused on Lyme disease. I did want to touch upon some key points from last week, and then we're going to be really spending the majority of our time today on Bartonella lab testing and treatment. Now, I use many. IGeneX is one of the companies I primarily look at when I'm looking at specialized lab testing for Lyme disease. So there are some slides particularly for them and their testing. Okay, so this is a disclaimer. Who am I? Lexi already gave my background, naturopathic physician. And so today, what are we going to talk about today? So we're going to review tick-borne diseases. We're going to go through, I want to go through some skin manifestations of what it looks like in Bartonella, direct and indirect testing. It also is important for me to also talk about PANS and PANDAS because that comes up when it comes to Bartonella, particularly for kids. Some of you may or may not be familiar with that. So I wanted to do a quick overview of that. And we will also go through treatment strategies. So why is this important? As we talked about in the last class, about 500,000 people are affected with Lyme disease. Yearly, they believe that number is a lot higher because that also depends on whether or not they were actually officially diagnosed. And as we discussed, there are at least 50% that are false negative by way of testing. So we estimate that number to be even higher. So how much is it related with co-infection? So approximately, according to the data, about 20,000 per year diagnosed with Bartonella, 18,000 per year with Babesia, and about 2,000 per year diagnosed with Ehrlichia and Anaplasma. And this is just the spread again, which I showed in the last class, where the presentation is. As you see, Bartonella, Babesia location similar to what you'll see with Lyme disease. And again, most tick-borne diseases are present in all 50 states. People traveling can contact disease in other countries and areas as well. So let's look at the modes of transmission. So of transmission. I know this came up before. People were asking about mosquitoes, fleas, things like that. So there are different modes of transmission outside of ticks. So we have obviously ticks. When we look at Babesia, we say blood transfusions can be possible. Infection with any tick-borne disease can definitely come from the mother to the child. If there is a mother who has Lyme disease, typically or a tick-borne disease, they're going to likely put them on antibiotics. For the child, you definitely want to test within 6 months, but you want to track them over the course of up to 2 years to see if they are positive. Bartonella, which we're focusing on today, ticks, fleas, cat fleas, that's why they call it cat scratch disease, body lice, sand flies, and flea-infested animals. And these are the other types of transmission. So I talked about what Lyme disease can present. I wanted to mention that quickly, erythema migrans, to show again its skin presentation, that it could look almost like a spider bite. And also I forgot to mention this in the last class. So I just wanted to mention other presentations of erythema migrans, that these lesions can, because of it can have a lymphatic spread. So it can actually present in a different way. And so one of them is called a Pick-Herxheimer disease, which is Acrodermatitis chronica atropicans. And it's a late manifestation of an EM rash. It's more common in Europe. So I just wanted to, I didn't show this in last class. This is actually a skin manifestation with Lyme later phase. So again, presenting different than the typical bullseye rash. Now, when we look at Bartonella, it looks more like literally like a scratch or a stretch mark. One of the big telltale signs is that it's not necessarily matching as typical to what you'll see in stretch marks. So the most common species, and we're going to talk about subspecies, is Bartonella henselae, also known again as cat scratch fever. You do not have to have a cat to have Bartonella. That's a question patients will ask you. But again, it appears like a stretch mark, will have many of the same symptoms that you'll see with Lyme disease, like fatigue, joint pain, body pain, fevers, dizziness. But what you'll see differently is a lot more neurological issues, including insomnia, dizziness, coordination issues. You could see POTS-like symptoms or racing heart. You can also see that with Babesia. Insomnia is common in Bartonella and Babesia, but you can see nerve pain, numbness, tingling. One of the common things my patients will say when they wake up in the morning, they might have lack of sensation on their feet, that they're hobbling, that Frankenstein feeling where they lose sensation. So there's definitely impacts, more neuro impacts. Again, dizziness, coordination issues. Patients might say, and you might want to prompt them where they feel like they're getting off a boat, like they're still moving. And so you'll see more manifestations of that, also mental impacts. They'll call with Lyme disease sometimes to Lyme rage or Bartonella, a lot of rage and moodiness and irritability. So those can also be impacted as well. So just wanted to mention quickly, as it pertains to Bartonella, tick-borne infections have been related to increasing up potentially autoimmunity. So Bartonella is one of the ones commonly known as a PANDAS, which I'm going to talk about later, trigger for children. So what are some of the laboratory tests? So if you look at it, about, again, 40%, we believe it could be higher, are tested for at least 2 pathogens when you are testing people. So you definitely want to check for other co-infections based on their symptoms. But to know things like Bartonella and Babesia, specifically Bartonella, it might take 2 or 3 times test before it'll be positive as compared to Lyme. And we're going to go through some reasons why and why you want to maybe do more advanced testing for that reason. So again, we talked a little bit about this last week about what's called direct testing and indirect testing. Direct testing is basically when they're looking for the bacteria and parasite in the blood itself, right? So that's going to be DNA, like PCR testing. You're going to see fish testing and actually culture. The indirect testing is going to be looking for actually antibodies. So that's the most common testing people use, is like ELISA test, Western blot. Immunoblot is going to be more accurate because it's testing. It's going to have a higher level specificity. When you're looking at things like IGeneX, you're going to be doing more subspecies like Henseleit. Well, we'll go through them, but versus just one that it's going to be looking for. So Immunoblot is going to be better. There's also IFA, and then there's also what they have is IgX spot, which is the T cell testing, which might be helpful if you have a patient in the first few weeks you suspect that they have it. That would be the time to do T cell, the IgX spot test. Now, if you have a patient that comes and says they believe, again, as a reminder, bit by a tick, it's a little bit premature to test them too early because the antibodies might take about 4 weeks before it's showing. So you might have to decide at that point to treat prophylactically, especially if they're not having any skin manifestations. If you look at IGeneX for Bartonella, they have multiple species in their immunoblots. They have the IgX spot test. They have IFA. They have PCR and fish testing, which is the direct testing. I also wanted to mention, because this comes up a lot and to put in your notes, there's something that people refer to oftentimes with persistent infections. These are people that have had tick-borne infections that have lasted for a long time. Bartonella tends to be the one that produces a lot of biofilm and is more resistant, right, with treatment. And so what you might hear is something called log phase and then stationary phase. So just want you guys to write that down: log phase and stationary phase. So when it's in log phase, that's actually the best time to treat because there's exponential growth. That's when it's best in like an acute infection. There's constant replication. There's exponential growth. That is the time where antibiotics can work the best because it's in its exponential growth phase, versus what's called stationary, which you guys may hear. Stationary, it's no longer actually growing rapidly. And so it's more resistant then to antibiotics. So when they refer to stationary phase, we're talking about more resistance to antibiotics. We're talking about typically more biofilm. These are usually individuals that have suffered for tick-borne diseases for a long period of time. So stationary phase versus log phase. Log phase is actually easier to treat because it's, again, having exponential growth. So just being clear and defining that for you guys. Okay, so a lot more specificity when you look at the immunoblot as compared to the Western blot. It'll look at many the species, the Bartonella species, and then it also details out with Digenix the 4 Bartonella species, Elizabethae, Hensley, which I said is the most common, followed by Quintana, and then Vinsone. And it has also 22 Bartonella specific recombinant antigens and 2 controls on the strip. Also, we have, again, this is the difference, direct testing, like I mentioned, where you're testing for it in the blood, DNA testing, PCR, and then they have now ePCR, which is higher sensitivity. And then we have the immunoblots. We have IFA, which is a 2-stage sandwich test, which is actually based on the antigen antibody complex formation. And then we have the T cell response IgX spot test. Now, Hensley and Quintana IFA tests are actually the most common test. Immunoblots are definitely better than the Western blot. PCR, though, is specific. It's not very sensitive. And I talked about this before, but some people, the difference with direct and indirect testing, some people don't produce enough bot antibodies. So they say about 15 to 20% patients might not produce enough antibodies, meaning that they may not show in a Western blot or immunoblot. And so if you suspect somebody has all the symptoms, this is when you may want to look at the direct testing, like PCR testing, fish testing, et cetera. Now, when it comes to Bartonella, I would say early on, this is a place where you want to definitely look at immunoblots as well as direct testing, because oftentimes it is less likely to show in the lab work, even with the Lyme literate vendors like an Igenix. So if you look here, this is just an excerpt here, PubMed article. Sorry, my thing is covering the screen. So this one showed a detection of the antibodies, anti-B, Bartonella, Hensley, IgM, and IgG antibodies by IFA actually lack specificity. And if you look at the data, the hallmark of acute disease only remains detectable for actually 15 weeks after exposure. And so IgG is about 22 to 28 weeks, with only 25% that are seropositive after 1 year, making it hard, especially if someone has had that past infection that is still struggling with the symptoms, because you see how low the rate is for being positive. Now, if you look at the data to show real-time PCR and IFA, because this one I just talked about, it was specific for IFA. If you use the data has shown use of real-time PCR and IFA significantly increases accuracy, particularly for detecting Bartonella henselae. So again, this is why you want to look at immunoblots, and particularly when you're looking at Bartonella PCR and IFA, even though IFA is a common test, they're showing that PCR plus IFA significantly increases the accuracy for positives. Okay, oops, sorry. Okay, so now let's look at treatments. So going into treatments, again, being mindful of time, I'm going to talk for another like 15 minutes, and then we're going to go into questions. As I mentioned, the log phase, stationary phase, Lyme disease, again, tends to be more up persister cell stationary phase. When you look at the antibiotics, the more effective ones are the sulfa drugs like dapsone, because of what I mentioned, being more stationary phase. So the sulfa drugs like dapsone, you guys have probably heard Dr. Horowitz presents pretty frequently on that for treatment, and particularly again for stationary phase, which Bartonella is likely to be. If you look at these antibiotics, rifampin, erythromycin, azithromycin, doxy, cipro, have low minimal inhibitory concentration against Bartonella henselae. Rifampin has been shown to be good for growing Bartonella, again, in the log phase, not necessarily stationary phase. The sulfa drugs have been shown to be more effective, or combinations of daptomycin, doxy, and ceftriaxone. Typically, it's going to be a combination of several, but rifampin has been shown if it's early phase, again, more log phase versus stationary phase where somebody's had it for a while. However, just to point out, I'm a naturopathic physician, so of course, going to talk about herbs, or oregano and cinnamon bark have shown highly active against stationary phase Bartonella henselae. So when you look at the herbs, many herbs have shown to be effective, if not more effective, for persister infections, particularly with Bartonella. Oregano and cinnamon bark have been studied for stationary phase. Now, if you look at Juglans nigra, which is also known as black walnut, another one for Bartonella that has been shown to be effective against stationary and active log phase forms, both. As well, monolaurin has shown to be effective against many different bacteria. As I mentioned, PANDAS, that will sometimes come with other viruses like mycoplasma or strep. Monolaurin has also been shown to be effective for staph, listeria, strep, and biofilm-like colonies. There's a lot of biofilm that might be one to look at. Hoodatunia, I mentioned that before. Hoodatunia is one that's commonly used for Bartonella, also mycoplasma, antimicrobial, and antiviral. I'm just going to quickly touch upon these, which we talked about for Lyme. These are the common protocols people are looking at. Buhner's protocol, with the core protocol being Andrographis, cat's claw, Japanese knotweed, as well as cryptolepis and artemisia, being said to help with many tick-borne infections, including Bartonella. Cowden protocol, which has different herbs, particularly a combination of herbs that rotate every 4 weeks, about 6 to 9 herbs. And they have very specific ones, particularly for Bartonella, Tunia, and also have shown to be as effective, if not more effective, than antibiotics. Byron White has a protocol, not necessarily a protocol. They have 40 formulas. Their drops are about anywhere between 5 to 10 drops twice a day, but particular formulas made for Bartonella and Beyond Balance as well, having things like MC Bar 1, MC Bar 2. They have about 4 products, particularly for pathogens and immune function. So there's many different protocols. I also use Dr. Zhang's protocol, but I wanted to mention the key ones, herbal, that folks know. And as I mentioned, making sure you talk to patients about Herxheimer support, what a Herxheimer response is. For those that don't know it, it's really about these spirochetes coming out and having this die off. And so one of the things that can help is putting patients on natural anti-inflammatories, also neutralizing, helping with acidity by doing things like bicarbonates, Alka-Seltzer Gold, trisalts, things like that, to also help and also hydration is super important, because again, if we're having them kind of release things, we want to make sure that they're actually hydrated, especially throughout the day, which a lot of patients, unless you prompt and ask that question, don't necessarily mention. Okay, so medication treatment. These are the most common medication treatments. I mentioned, again, the sulfa drug showing most effective, though, for a stationary phase. IVIG is another one. And also, they did show in studies good activity against stationary Bartonella. Study showed 25% stationary phase of Bartonella remained following exposure, though still to methylene blue, but some good activity with methylene blue for patients with Bartonella. Now, these are just general immune support things too. You want to do it in the background. I mentioned oregano already. I mentioned cinnamon bark. Astragalus also helping with immune function, and then other anti-inflammatories. Now, I also wanted to discuss something that's going to come up a lot when you are working with patients with Bartonella. One of the common, you'll see a lot of children. So in our practice, about 40% of my practice base are kids under 18 years of age. And of those, many of them will have Lyme disease, but they may also have PANS and PANDAS that hasn't been worked up. So for those of you who's not familiar with PANS and PANDAS, I want to go into that, because if you have a patient, especially a young person with Bartonella, you also want to make sure that they are worked up for PANS and PANDAS. So I just wanted to put a little bit of information on that, and then we're going to open it up to Q&A. So it's a controversial diagnosis, just like with Lyme. It's still considered clinical diagnosis, often connected with children with Bartonella. And what happens is it's considered a type of autoimmune encephalitis. You have this dramatic onset and severity of symptoms of OCD, food restrictions. So many of my patients have to work with the nutritionist and also maybe a therapist to help introduce new foods into the diet. So you might see restricted eating. But what you'll see is this acuity. So I remember when I first started working with patients for PANS and PANDAS, I actually had some patients I hadn't seen in some time, and they said, "Oh my gosh, my child just changed overnight. They went into, it was like a new kid." And so there's this acuity where all of a sudden they may have gotten sick or an illness, or maybe that didn't happen. And they all of a sudden have a lot of anxiety, insomnia, behavioral regression, et cetera. These are the common symptoms you'll see: behavioral regression, tics. So you'll see these repetitive behaviors, patterns, even muscle spasms. They'll have a lot of mood changes, rage and aggression. It can happen at different ages. So I've seen kids as young as 7 or 8 with it. And I've also seen them phase out once they go through those hormonal shifts. And I also see some that it occurs as they're going through the hormonal shifts around like 12 to 14 years of age. Those significant mood swings, panic attacks and severe anxiety, insomnia, they could even be reversal in fine motor skills and muscle strength. Also, urinary changes, you'll see enuresis, nocturnal enuresis. You'll see accidents, frequency, they'll say urotox or I forget, it's called basically where they're needing to urinate all the time as part of their like kind of detoxing. Sensory amplification, sounds, etc. Also deterioration in academic performance, where now there's this regression in academics that they didn't have these issues before. So it is a diagnosis of exclusion. As I mentioned, you'll see this dramatic onset of these symptoms, including things like OCD, but OCD doesn't have to necessarily be in the typical OCD we're thinking could include intrusive thoughts, for example, worrying about a fear of a parent and worrying about they're going to come home at night and they can't let go of that intrusive thought. That's also a presentation of OCD, not necessarily by those repetitive behaviors, but also intrusivity of thoughts. It causes really, when you look at PANS and PANDAS, it causes this blood-brain barrier disruption, neuroinflammation to the brain. It's oftentimes, you look at PANDAS associated particularly with strep. So we're going to talk about lab work to look at, but you can see elevated anti-streptolysin antibodies, anti-DNase antibodies. You'll see one of the questions you want to ask is there a frequency with the parent of upper respiratory infections, sinus infections, ear infections, how their health history was younger and getting sick. And also if there's a family history of autoimmune condition, is PANS and PANDAS is also more common in boys and girls. So looking at the full history, psychiatric, some of my patients do have to get on psychiatric meds if it's warranted in terms of the safety for the child. And these are just differentials you want to look at as well. OCD, anorexia nervosa, that could be a big overlap because of the restrictive eating, Tourette's, bipolar disorder, and other autoimmune conditions, and also even things like Wilson's disease. So this is the blood work you usually look at for it. So you're typically looking at immunoglobulins. A lot of times the treatment are things like IVIG, ANA. You want to look at other things that can be contributing, like iron deficiency, because again, there's less blood flow to the brain. They're not going to be performing as well. So that could also be a factor, especially for kids. Histamine. So you look at things like histamine serum, definitely has to be frozen. So that's important to notate. But histamine is another excitatory neurotransmitter. Sometimes my kids with PANS and PANDAS or Bartonella or mood changes may also have these seasonal changes that affect their mood. So when we look at the blood work typically for PANS and PANDAS, you're going to look at something called ASO, which is anti-streptolysin O, anti-DNase B, some other viruses connecting, not just Bartonella, but Mycoplasma is another one. Epstein-Barr viruses, Coxsackie, HHV6 titer. So these are other ones that can be actually contributing to it. There's also specialized lab work. You look at companies like Cunningham panel, which I even do for adults if I think there's neuroinflammation. So that's going to look at also things like dopamine D1 receptor, the antibodies. It's going to look at antitubulin. So these are some of the antibodies connected with neuroinflammation that is connected with PANS and PANDAS that might be elevated. And so this is a specialty test you may want to look at, especially if you do this blood work and things come back negative, but you suspect it. You might want to do a specialty testing for these antibodies with the brain. As I mentioned, this is also family history. If there's a family history of autoimmune condition, putting it more at risk. And when you look at treatments, it's a mix of several things. So typically it's immunomodulatory treatment, antimicrobial treatment, and also psychotherapeutic treatment as well. So if you look at the standards of care, psychotherapeutics, you definitely want to make sure if you have a child that has PANS and PANDAS and Bartonella, obviously going through therapy too. This is the typical, including things like CBT, IVIG, as I mentioned, anti-inflammatory medications, and antimicrobials like antibiotics they may be put on. Things like azithromycin are pretty common for an potentially extended period of time. Also, some additional treatments, things like neurofeedback, may look at neurotransmitter testing, which we do in our office frequently, things like L-tyrosine, if their dopamine is low as a precursor, L-theanine, 5-HTP, and GABA. Some studied antimicrobials include things like cryptolepsis and artemisia. So this is great because this is an opportunity to couple if you have a patient that has Bartonella plus Lyme, plus PANS and PANDAS, doing things like cryptolepsis and artemisia can cover all of those infections together. Oregano, as I mentioned, is also helpful not only for tick-borne infections, also for PANS and PANDAS, plus helps with biofilm. And then also you want to make sure they're on immune supporting things like beta-glucan, vitamin C, and also potentially anti-inflammatories like turmeric and quercetin. The gut is really important because these children tend to have, again, more restrictive eating. So they may be deficient in a lot of minerals and nutrients, including iron. So you want to look at diets that are more anti-inflammatory. One of the things is trying to introduce as many good foods as you can, but also being mindful of food sensitivities and also any foods that can potentially aggravate them. So I'm going to open this up into Q&A. This is my email here to connect. I also have, and I think we're going to either Quentin or Lexi's going to go through basically product demo or showing some areas for Rupa. But I also created a scan if you guys are interested, which is actually all the labs. So I wrote a book called Women in Lyme. And so it goes in through labs, including hormone testing. But this is also the labs, my go-to labs that I frequently use with patients. So definitely check that out so you can get access to it. This is how to email me because there's questions after, but we are going to open up to Q&A and we will take it from there. So Lexi.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.